Hello, thank you all for joining us. We have a couple people coming in here. I'm going to do some brief introductions. This is our LASIK live event, and we have a great group of people on our panel. We were going to have Marcy Rich, the LASIK coordinator at Dunes LASIK Center, join us, but it's been a busy day, so she's not going to be able to make it. But still, we have Dr. Steve Ferguson, the owner and vision medical director at Dunes Eye Consultants and Dunes LASIK Center. He's the one to my left, my right here. And then below us, we have our patient today talking about her LASIK story, Libby Redinger. Did I get that right?
Yes.
Perfect. Thank you, everybody, for joining us in the Facebook Live, and then both of you guys for joining and letting us talk about this stuff. And I think we got some really important and good information here. And I'm going to send it to you, Dr. Ferguson, if you want to go ahead and start talking about what LASIK is.
Fantastic, Mason. First of all, I want to thank you and Kaleidoscope Marketing for organizing and putting these things together. They're fantastic for our patients and new patients trying to figure out, if laser vision correction is the solution they're looking for. And of course, Libby for taking time out of her busy life as a college student to join and tell her experience. And I also am excited to announce that this is the 20th year anniversary of Dunes LASIK. Now, it's a bit scary for me to say that. It makes me really feel old. And the fact that we are now doing LASIK surgery on the next generation of patients, their parents had it with us in the early days. So it's a pretty exciting time. But great to be here and try to help answer questions and really make patients understand what the opportunity is in laser vision correction.
Of course, it's perfect. I didn't know about that 20th anniversary thing, or
Yeah.
that's amazing.
Pretty cool.
And then is there
We've been
also
around for a while.
a promo for LASIK patients going on right now?
Yeah, we've unfortunately Marcy couldn't join us, and Marcy is our coordinator of all of our LASIK activities, and that's the person that you interact with initially for your consultation. It helps us gather the data for me to evaluate if a patient is a good candidate and determine if they're going to be a right fit for laser vision. So she plays a very critical role, and she has created a promotion called Pay It Forward, which new LASIK patients of 2023 get the opportunity to sort of be part of the marketing team. And we've discovered over these 2 decades that almost all of our patients, I'm going to say estimate right now is probably 90%, have either been told about us, referred, or recommended by another patient that has experienced Dunes LASIK. So that's why we always say, hey, welcome to the marketing team after you have LASIK with us.
Perfect. Do you want to describe who LASIK is for? Is there like a perfect patient, or is there not? And maybe people that have joined the live events
question.
might know that there isn't one, because we've had patients on here before where it's kind of a bunch of different groups of people.
Right.
It's not
Right.
one specific type. But do you want to talk about that a little bit there?
Absolutely. So the very first beginning of whether a patient is a potential candidate, are they dependent on an optical device? Do they wear glasses or contact lenses for visual enhancement or be able to function? That's the beginning point. Then the next step is, what are you trying to achieve with your laser vision correction? And it is really starts to be kind of subcategorized. So if I have a 25-year-old patient that's nearsighted, their expectations level to have minimal use of any contact lenses or glasses post-surgery, and do that for an extended period of time till they start, the aging process gets up for near vision. And that's a very realistic goal. Then there's some patients that might sit in my chair and say, I'm having surgery, I'm never ever wearing glasses again. Well, bingo, that's unrealistic, because our goal with laser vision correction is stated very clearly. We're trying to reduce your dependency on an optical device, glasses or contacts. Now, if you're able to achieve vision stability and do most things in your life, or all things, fantastic. And I think the success rate of LASIK surgery across the world, across the US, is so extremely high because patients are able to find they can do many things without having to grab a pair of glasses. But it's very critical that each patient has an individualized assessment and a discussion to make sure the expectation levels are set properly.
And I would assume that that would affect that patient's quality of life quite a bit, wouldn't it?
Oh, geez, let's talk about someone that has allergies and suffers from trying to wear contact lenses that bother their eyes, and kind of that component. Well, by doing LASIK surgery, number one, you've really reduced that irritation, likely have provided vision better than they could ever have with glasses or contacts in a customized approach. And at the same time, reduced risk. So not only are you changing quality of life, let's just focus on contact lenses for a second. Contact lenses are medical devices, FDA regulated, and approximately 1 out of 2,000 to 3,000 patients that wear contact lenses over decades is going to experience a vision threatening or vision disabling event, and primarily from an infection. If you sleep in those contact lenses, that quickly shifts to about 1 in 1,000. So contact lenses, we don't view those that way. We view them as a commodity, and we view them as wearing them as long as we want till they feel bad. And unfortunately, the vast majority of contact lens wearers, including myself when I used to wear them, we violated what the good principles are. Tap water sometimes used to kind of rinse off a lens, that's a no-no. Sleeping in them for extended periods of time beyond maybe what's recommended, that heightens risk. Not washing your hands before you put them in, using different solutions to try to disinfect, and not replacing them on a very frequent basis. We all do that. All of our patients do. So when we're working with contact lens patients, we try to protect them against themselves and prescribe, programs that are going to provide minimal risk. But when you start comparing those risks to laser vision correction, it's so dramatically different. And I think that's why changing quality of life or improving things is a realistic expectation for a patient.
Now, when it comes to the technology side, do you want to kind of talk about some of that
Yeah.
and talk about eye design and what that
Yeah. I
is?
think when you think about technology in laser vision correction, every top center across the country has some approach to customize the visual correction. And that's when you hear the word customized laser vision correction. And that is using technology to assess the visual optics of each individual's eye, and then you apply that to the laser. And I want patients to understand there's two types of blur or distortion to our vision. Something called a low order aberration. That's your nearsightedness, your astigmatism, your farsightedness. That's a generally kind of makes a blur. And then there's something called high order aberrations. And they're different for almost every single patient. High order aberrations affect image quality. So you could have a patient with 20/20 vision that's 20 happy and one that's 20/20 and says, I'm not so happy, because their aberrations are different. Now, the cool thing about the eye design is we can measure those aberrations and apply that to the laser vision correction and reduce the impact of those, which heightens the quality of vision, the acuity level of vision, and even low light vision. So that's been a huge breakthrough. And there's nothing special about Dune's LASIK that we have it and somebody else does it. Anybody that's doing it standard of care, that's what they have. My biggest concern, there are a lot of sort of chain centers out there that kind of scare me, because they sort of promote a reduced quality experience. And that's where patients can get into trouble. And that can lower our broad-based 20 happy patients out there. So be careful when you're selecting where to go, that you're getting the individualized optics of your eye measured and treated.
Yeah, all of that is very important stuff that I feel like there's a lot to consider when you're making such a big decision like
Well,
getting
it's a
LASIK is.
Mason, this is a once in a lifetime decision. So you want to
Exactly.
combine experience, technology, and understanding the variables that can come into play post-surgically, letting patients know that, setting expectations, and then critically evaluating the ocular surface health and tear film prior to surgery. The most important modifiable effect we can have on surgical outcomes is pre-treating the ocular surface and primarily altering the tear film. Tears are the first visual lens of the optical system, and they also nourish the eye. They're more complex than blood. So if you come to us, we are intently focused on assessing tear film and making sure it is optimized before you have surgery.
And going back to that experience and the patient experience, here's where we would have talked to Marcy a little
Yeah,
bit, but
yeah,
do you want to kind of cover that and what that
yeah. So
experience for the patient looks like?
the nice thing about doing LASIK, and I think there's many LASIK centers that offer this, we offer free consultation because it's okay. You want to find out, you want to learn if you're a good candidate, and the technology is like a topography, a map of the cornea. We have to look at the cornea. That's what we're working on. Is it structurally sound? Is it thick enough? Is it regular? There's some things that we have to consider. And then we take a good look at the general. We take an evaluation of the retina. We look at everything. And then we also pay special attention to a tear film analysis. And that's all at no charge when you come to see us. Then I can come in and sit down and go, hey, what are you trying to accomplish here? Huh? And in some cases, I might have a 50-year-old patient that says, you know what, I'd really like to reduce the fact that I have to wear bifocals. Hey, that's very realistic. Or a patient says, hey, I'd like to minimize my need for glasses. And we have to look at the visual measurements, make sure that that is a very high probability that we're going to be able to provide that solution and demonstrate it in some cases. So, I mean, it's all part of that experience, but it's so valuable. You can't cut any corners in doing it. You have to take the time and really make sure that patients know what they're expecting. They can make a good decision along with us making a great decision with them.
And when it comes to that decision, I know a lot of times kind of like affordability comes into play
Yes,
there.
right on,
Can you
right
talk
on.
about that? And then also like flex dollars, FSA dollars, and
Yeah,
even
yeah.
that life savings calculator that's on the Dunes
Yeah,
LASIK
that's a pretty
website.
interesting thing, isn't it? I can't take credit for that. That's Joe Kelly from Kaleidoscope Marketing finding that and said, this is really valuable for people. And I guess it's all about I look at it from, hey, if you wear contacts and glasses, number one, it's nice not to have to depend on them. Number two, we can provide you a quality vision in many cases better than you can get with glass or contacts because the laser vision correction is more precise. But then in today's world, we know that contact lenses and glasses that are the best technology, which what we offer at our center, because we have an optical, we take care of patients with contacts as well. It's an investment. And many people choose to have that investment so they have the best and safest contact lens approach. They also want the best eyewear they can have, with all these great technologies, but it does come at an investment value. And it's fairly significant. So when you start throwing that into the calculator comparing to LASIK, it can be kind of interesting what that result is. And many folks go, wow, I didn't realize I'm going to save this much money from doing LASIK, especially when you're in that 25 to 35-year-old crowd. So yeah, it's interesting.
Yeah, it's a lot to consider. And I would like to, for everybody that's watching right now, if you have any questions or stuff, I think I forgot to tease this, but at the end, we'll actually be taking those questions and answering them. So if anybody that's watching has a specific thing that either from our patient or Dr. Ferguson that you would like to have answered, go ahead and leave that and we'll talk about that later.
I'll forward all
But
those to Marcy.
I don't know. Yeah, exactly. I don't know. I kind of want to talk to Libby a little bit here. We did have in our layout before we're going to talk about how LASIK works, right, with you, but I feel like we've talked a little bit
I mean, if you want me to
about
tell
that
you the
already.
specifics of how the technology works, I can certainly do that in a couple seconds. Well, a
Yeah.
couple minutes.
Okay. Yeah. Let's go ahead and do that then.
So basically today, LASIK is done with two different lasers. One laser is used to create a very precise, like horseshoe shaped flap in the cornea. And that has replaced a manual device from decades ago. And so it's really almost eliminated the potential of any little complication in creating the flap because it's an amazing technology. So that's number one. And we can control exactly the thickness that we want to do. Number two is the laser that reshapes the eye is called an excimer laser, sometimes referred to as a cold laser. And the way that it works is it breaks molecular bonds. The energy and basically the molecules just poof, evaporate into the atmosphere. It's called plume. And so it's pretty remarkable. And it takes place very quickly. And to gently reshape the eye, the flap is put back. And within 4 to 6 hours, the initial healing process has already taken place. So most of our patients, after 4 to 6 hours, are feeling pretty good. And so it's pretty remarkable. The eye is the fastest healing organ in the body.
Hey, you learn something new every day. I didn't know that,
So
but
yeah.
that would certainly help with that recovery time.
Oh yeah. Yeah. It's amazing how fast you recover.
Well, awesome. I think we should probably transition now and talk. Libby, can we talk to you about
Yeah.
your experience? And
Yeah.
could you just give us a brief overview with your time at Dunes LASIK Center and what all you did with Dr. Ferguson?
Right. So I at first was not thinking about getting LASIK, but my mom had gotten LASIK in one of her eyes. And ever since she got that done, she kept telling me, she's like, you have to get it done. And so I had an appointment set up with Dr. Ferguson and went in, and he had said that my eyes looked great to get the surgery done. And I kind of told him how I am like a dance and cheerleader here at Dort. So like having to rely on glasses and contacts all the time, especially being like a busy college student, can be a lot. And like there's many mornings where it's like hectic and I'll be running out of my room and it's like I forgot to like bring my glasses, and so then like I'm sitting in class and I'm trying to squint. um so I kind of explained how I would like to reduce the like using glasses and contacts and relying on them. And he said that I was perfect candidate for this surgery. And so right then and there, I ended up getting the surgery the next week. And I went in, I got it done, and the recovery time, like the next morning, my eyesight was like, I could actually see, which was like a big relief.
That's amazing. Yeah, and that that that's a lot of good things to talk about with the before, but then what did you experience after, and even after that next day, like as time went on, how has your life been impacted by now having LASIK?
Right. Right. Well, afterwards, it was nice because it was like, in my morning routines, it was like, as a college student, something you don't have to worry about. And I could just tell, like, distance wise, because that was like my struggle with my eyesight, was like seeing far away. And like, so when I'm like driving and stuff, I just felt like I could see more clear than when I did have my contacts and my glasses, and like constantly having to have those appointments like of going in and getting my contacts changed because my eyesight continued to seem like it was drastically getting worse. um
Yeah, so
so
what is your vision like now? Is it 2020? And do you remember what it was before?
right, I did not remember what it was before, but it was not good, I can tell you that. I relied pretty heavily on my glasses and my contacts in a day-to-day basis before I got my surgery, but now like I can see like like clearly, and I don't have to rely on any of that, so that is nice.
And then, like you were talking about being a competitive cheerleader, can you imagine not having LASIK for that, or how much more complicated do you think that would be doing like
Right.
the jumps and everything and
Yeah.
all that stuff?
Honestly, it's been a life changer, like not having to worry about that added stress of like having to put in contacts, because I know even in high school when I was in dance and cheer during that time, like my eyes never really like liked having contacts in, and I always struggled, so I always had redness, or yeah, like my eyes felt really dry or itchy. And so that was always just a pain because it felt like if I couldn't get contacts in, I had to rely on my glasses, and you can't really perform with your glasses on. So it definitely has been a big difference and made a big impact in my life since I got it done. So I definitely recommend.
And then especially too with contacts too, I feel like not a lot of people talk about it, but sometimes contacts will like fall behind your eye or stuff, and then that could like
Yeah.
put you out of commission
Right.
for a good
Yeah.
solid minute.
Yeah.
And yeah, that's not. I can't imagine having something like that during a performance or something.
I
But
can't.
in
Yeah.
addition to cheerleading and college, you also have a business. I hear
Yes.
sounique.com. That's a
Yes.
sustainable, one of a kind clothing company.
Mm-hmm.
Oh, that's very cool.
Do you think it helps not having to waste time putting contacts in with that side business?
Yes, for sure. I feel like just everything like that I do, like in college, like college is busy for kids and stuff, and I feel like having that out of my routine in the morning makes life a lot more easier and enjoyable. But yeah, like not having to rely on going point A to point B and being like, oh, I forgot my glasses, I can't see.
Yeah, just one
Um,
less thing to think about in the morning, and then also at night to take them out and
yeah,
everything.
right.
But would you recommend LASIK at Dunes LASIK Center, and maybe why?
Yes, I definitely recommend it. Honestly, everyone there was just like they gave me like a big overview of what was going to happen, and everyone was very like nice and welcoming to this whole situation, and I felt really comfortable going into the surgery. I wasn't honestly worried about the surgery, and like the recovery process was so fast, so it wasn't even like something that, like I was out of commission for a few days. Like it was like I slept it off, and the next day I was like, "Oh my gosh, I can see."
That's
Um
amazing.
so yeah, so me and my mom both like had great experiences at Dunes, and I honestly wouldn't like trust anyone else to do the surgery with than you guys. So yeah.
Well, that's awesome. And we're kind of slowly getting to our end here, but Dr. Ferguson, would you like to talk anything about maybe Libby's treatment or anything there?
Well, yes, I would. Libby is just an ideal candidate for her age, and just everything just lined up perfectly for her. And when we have a great candidate in the LASIK box, this is the expectation level we have. And it's the most enjoyable thing that I've ever been participating in practice. We have a very uh, sophisticated center at the Dunes. We take care of a lot of different eye problems and vision problems. And LASIK is a subcomponent, subspecialty part of our practice, but it makes so many people happy. And we take it so seriously too. I mean, we respect the fact that they're trusting their vision and eyesight to us, and have been doing that for 20 years. And it's a big deal. It brings you back every day to take care of patients like Libby, see their joy, and that's what it's all about. And so we've been very fortunate to be able to play in this world, and it continues to kind of drive me to keep going forward. I got a lot of energy left in me as far as taking care of people because it's so much fun to see their happiness.
That's awesome. That's amazing. And we're getting to that question portion of the stream, but I feel like we must have been pretty thorough because I don't see anybody asking anything, and we have a good amount of people in here. Oh wait, we do have one question. Sorry,
Sure,
spoke too soon.
that's
Um,
right.
why did Libby's mom only have LASIK in one eye?
Fantastic question. So Libby's mom has reached the point in her life where her focusing up close doesn't work as well. It affects all of us. I promise you. I'm a little bit older, right? And so that's called presbyopia. So if you're born with perfect vision, typically in our 40s, we start to lose that up close effect. And we're dependent on, say, a reader or a bifocal to help us see up close. So in her case, we were able to do what's called a blended vision. We took her dominant eye and corrected it perfectly for distance, but left her slightly nearsighted eye behind so she could use that for up close vision. And it's sometimes referred as monovision, but we do that quite a bit in our over 40 population. And it just worked out beautifully for her, and that is why. Great question, though.
Hmm, very interesting. And
Yeah,
yeah, that's pretty much all that we have today. I guess I would like to thank you, Libby, for coming on, joining,
thank you,
talking with
Libby.
us.
Yes.
Thank you, Dr.
Yes, thank you
Ferguson,
guys.
for all the important information. And if there's any other questions that people watching have, uh, everybody go to duneslasik.com, check out that lifetime savings calculator. There's a lot of good information in there. And then check out our past streams. There's infomercials on Facebook and YouTube, so there's a lot of information out there for everybody to go and see if you have more questions or want to learn more about LASIK.
Thank you, Mason. The best patient is the most educated patient. We want every question
Absolutely.
asked and answered, no little uncertainty at all. That's the most important thing when they choose to make decision to change your life through laser vision correction.
Perfect. And it's pain-free, correct? We had somebody just ask, does it hurt?
Well, the procedure itself is pain-free. The recovery, you have about 4 hours where we ask you to sleep to miss most of that initial healing. And so, but the procedure itself is very easy to go through.
Well, amazing. Thank you, everybody, for watching.
Thank you, guys.
Thank you,
Thank you,
two.
Libby.
And
Yeah,
we're going to
thank you.
wrap it up here. Thank you, everybody,
Great.
for watching.
Thanks, Mason.